So, Bismillah ar-Rahman ar-Rahim. Okay, so we're going to be talking about COVID-19. And so let's get into it. At the start of these presentations, we always remind everyone that this situation is changing day by day. Even it's changing hour by hour. So please keep yourself informed with up-to-date, accurate information. The websites that we recommend that people go to for up-to-date, accurate information is, first of all, the Fairfax County website, which is fairfaxcounty.gov/COVID-19. If you go to that website, that's a county-wide overview of COVID-19. You can also check out our health department website from there as well. Another good source of information is to go to the CDC. That's cdc.gov/coronavirus. Of course, that's always a good place to go for any public health information. So, what is coronavirus? So, the important thing to mention is that coronavirus doesn't refer to just one virus or one disease. Coronaviruses are actually a large family of viruses. And in this large family of viruses, we have things like the common cold. We had SARS, severe acute respiratory syndrome, in 2002, 2003. We had, in the year 2012, we had Middle East respiratory syndrome, or MERS. And now we have COVID-19. These are all coronaviruses in the family of coronaviruses. And now we have, unfortunately, a new baby, if you will, in this family, COVID-19. So coronaviruses do cause the common cold. Sometimes we see new coronaviruses emerge from animals to cause severe disease in people. Of course, this disease, COVID-19, is spread through coughing, sneezing, or close personal contact. Symptoms typically appear anywhere from 2 to 14 days after being exposed to the virus. Most people get symptoms 5 to 6 days after being exposed to the virus. The specific name of the virus that is causing this disease is called SARS-CoV-2. This is what the virus looks like, and this is the name of the virus itself. The reason it's called SARS-CoV-2 is because this virus, in its structure, is similar to the SARS virus. However, it's a different disease than SARS. It's caused by a different virus than SARS. So please keep that in mind, that it's not the same virus and not the same disease, but it's in the same family of coronaviruses. So let's talk a little bit about the emergence of COVID-19. Infections were first recognized in the city of Wuhan in China. The virus, the SARS-CoV-2 virus, or the COVID-19 virus, likely came from bats. But in order for the virus to go from bats to people, it needed to go through an intermediate animal first. So what that animal was, that the virus jumped from bats to that animal, and then that animal, the virus is mixed in that intermediate animal, and then jumped to people. We don't know what that intermediate animal host is yet. There are some theories, like for instance the pangolin, but we don't know exactly yet what that intermediate animal host was. If you're wondering where the name COVID-19 comes from, the CO stands for corona, the VI stands for virus, and the D stands for disease. And of course, the 19 refers to the year 2019, the year in which this disease was first recognized. That's where we get the term COVID-19 from. What are some symptoms of COVID-19 infection? Some common symptoms include, first of all, a fever. And when we typically refer to fever at the health department, we usually talk about a fever, meaning a temperature over 100 degrees Fahrenheit. Another common symptom is cough, particularly a dry cough, and shortness of breath. Other symptoms also include things like fatigue, muscle aches, bone pain, joint pain, loss of appetite. You can also experience some other symptoms with the gastrointestinal tract, with the stomach and small intestine. But these are some of the more common symptoms. There are also some lesser common symptoms. We're still learning more about this virus, and so we'll learn more as time goes on about more signs and symptoms. But these are some of the main signs and symptoms of COVID-19 infection. Again, symptoms appear 2 to 14 days after being exposed to the virus, And most people typically start showing these symptoms about 5 to 6 days after being exposed to the virus. How does COVID-19 spread? So you see here in this image, you see a person coughing or sneezing into the air. You see all of these respiratory droplets. In these tiny droplets, we have things like bacteria, germs, viruses, including coronaviruses. Now, these respiratory droplets, they don't travel very far, typically only about a distance of within 6 feet. So they're not going to travel for, hundreds and hundreds of feet, nothing like that. Once a person coughs and sneezes like this into the air, gravity kicks in. It will drop these respiratory droplets onto the ground, onto surfaces, our body, our hands, our face. We can even breathe in these respiratory droplets. Sometimes these respiratory droplets land on our hands. Then we touch our face, our nose, our ears, our nose, our mouth. This is how the virus gains entry into our body. If these respiratory droplets get onto our hand, we can shake hands with people, transmit the infection that way. We can touch a surface, and we can spread disease that way. The most common way this disease is spread is when people cough and sneeze into the air, and these respiratory droplets are either inhaled through close personal contact, or, as I said, they get onto our hands and we touch our face. This is the most common way that this infection is being spread. How does this disease spread compared to seasonal flu? Seasonal flu is a separate virus. It's a separate disease. It's not in the family of viruses known as coronaviruses. It's in a different family, but it has some similar signs and symptoms to this disease. Flu is contagious, but this disease, COVID-19, is very, very contagious. It's actually much more contagious than seasonal flu, which is one of the reasons why this is of such great concern to the public, because this is spreading much more easily than even seasonal flu. So we talked at length here about how COVID-19 is spread. How is COVID-19 not spread? So COVID-19 is not really spread through food and drink. It's not really being transmitted or spread that way. So people who have concerns about getting it from food and drink, there's just really no concern for that. It's not really spread through getting packages in the mail. So if you're getting a package in the mail from Europe or China or something like that, do not fear that you will get COVID-19. These viruses do not typically last on such soft surfaces for very long. They last a little bit longer on hard surfaces. I'll talk a little bit more about that later when we talk about cleaning. They also don't linger in the air for like hours and hours and days. So it's not like that. Again, I want to stress most people are getting COVID-19 through close personal contact of respiratory droplets landing on their face, or they're breathing it in, or they're getting it in through their hands. That is how COVID-19 is being spread. Oh, and one last note. What about bodily fluids, excretions like urine or sweat or blood or feces? So right now, again, information is changing. But according to the Centers for Disease Control, this is not thought to be a way in which COVID-19 is spreading. At least that's what we think for now. So again, respiratory droplets is the way this disease is spreading. So who is at risk? First of all, who is at risk of being infected with COVID-19? Anyone who's living in a community where COVID-19 disease is occurring is at risk for infection. You may have heard the term community spread of COVID-19 disease. What does community spread mean? Community spread simply means if someone has an infection with COVID-19 and they don't know where they got infected. They weren't traveling to some other place in the world. They weren't in contact with someone who was traveling. In other words, they just picked up the infection in their own community. That is called community transmission or community spread. Question, have we observed community spread or community transmission in Northern Virginia? The answer is yes. We have over 100 cases of COVID-19 infection in Fairfax County alone. And what we are seeing in areas of Northern Virginia is we are already starting to see community transmission of COVID-19. In other words, people in Northern Virginia are passing it off to other people, and they don't know where they got the infection from, and so this is already starting to occur in Northern Virginia. The risk for infection is elevated for people who are in communities where there are more cases. Healthcare workers caring for patients with COVID-19, close contacts of persons with COVID-19, and travelers returning from affected locations. All of these groups of people are at increased risk for getting infected with COVID-19. So now let's talk about who is at risk of severe illness from COVID-19. So first of all, you see an image here of an older adult. So anyone over the age of 60 years old, 60 years of age, is at increased risk of severe illness. And when I say severe illness, what am I talking about? What does that mean? We're talking about, when we say severe illness, we're talking about your infection is so severe that it requires you to be hospitalized. Maybe you're experiencing difficulty breathing. Maybe you will develop pneumonia. This is what we call severe illness. So anyone over the age of 60 is at increased risk of severe illness. Here you see an image of somebody who's clutching their heart, here to signify that any person of any age who has an underlying health condition, you are also at increased risk of developing severe illness. What do I mean by underlying health condition? I mean chronic conditions, conditions which people are living with for a long period of time, like diabetes, asthma, heart disease, lung disease, especially these types of diseases. Or maybe you are immunocompromised, meaning your immune system is not working as well. Maybe you're a cancer patient and you're taking medication which suppresses your immune system. All of these groups of people, although not limited to just these diseases, but people in general, if you have an underlying health condition, a chronic condition, and you are of any age and you get COVID-19, you are also at increased risk of severe illness. Finally, here we see an image of a pregnant woman. According to the Centers for Disease Control, we don't yet have concrete information that shows how COVID-19 is affecting pregnant women. What we can tell you for sure is that when a woman becomes pregnant, her body undergoes changes. Her immune system is not functioning at a maximal level. And because of that, it leaves her more prone to developing infection. So anytime a woman gets pregnant, she should take precautions against getting any type of infection. And so we do advise pregnant women to take proper precautions against COVID-19. Now, one picture you don't see here is someone who's a young person, less than 60 years of age, who's just generally healthy. The question here is, can someone who is less than 60 years of age get infected with COVID-19? And if they do, can they get severe illness due to COVID-19? The answer is absolutely a big yes. If you haven't heard by now, there are cases of younger people, people less than 60 years of age, being hospitalized with COVID-19 and even dying because of COVID-19. So if you think that you are younger than 60 and you are invincible against this, please think again, because that's just not the case. Your risk for being a younger person, if you're healthy, you don't have any chronic conditions, is definitely lower than the people that you see displayed here, but it doesn't mean your risk is zero. Every year with seasonal flu, we see people who are young, who are in their 30s, even 20s, 40s, who are being hospitalized because of flu. And this is a respiratory illness that can most certainly affect younger people as well. So please keep that in mind. Everyone needs to take the proper precautions. How can COVID-19 affect me? How can it affect you? So what you see here in this first image is a couple enjoying their meal. Seemingly everything is okay. So what we know with this infection so far is that about 6 out of every 7 people, or about, you can say roughly 80 to 85% of individuals who get infected with COVID-19, they don't display any symptoms or maybe mild symptoms. And they typically recover within 1 to 2 weeks after becoming sick with COVID-19. Their immune system naturally fights off the infection without too much medication. They don't need to be in the hospital. and they just recover on their own at home. This is the situation for about 80 to 85% of individuals who get COVID-19. Unfortunately, about 1 out of every 7 people develops a severe illness. So about roughly 15% of individuals who get COVID-19 infection, they will develop severe illness. And so again, about 1 in 7 may need hospitalization. How does this rate compare to seasonal flu? Well, to give you an idea, in seasonal flu, about 1 in 50 people with seasonal flu will require hospitalization, or about 2%. So about 15% of individuals who get COVID-19 need to be hospitalized, but with seasonal flu, it's only about 2%. So again, showing you, I'm trying to give you a comparison to show you that this is more severe than what we see with seasonal flu. About 1 in 20 individuals who come down with COVID-19 infection may need intensive care in the hospital. And about between 1 in 50 and 1 in 100 individuals who get COVID-19 may die. So this is about 1% to 2% of individuals who get COVID-19, unfortunately, will die. And that is, by 1% to 2%, we're talking about in the general population. Obviously, the older you are, the more your risk is. It increases. For instance, people who are between the ages of 60 and 70, your risk jumps to about 4% of dying. If you're between the ages of 70 and 80, your risk jumps to 8%. And then if you're between the ages of 80 and 90, your risk of dying jumps to about 16%. So it keeps on increasing the older you are. It doesn't mean that you can't die if you're younger, but certainly the older you are, the greater risk you are at dying for COVID-19. Again, how does this death rate compare to seasonal flu? With seasonal flu, we see about 1 in 1,000 may die in seasonal flu. So again, what we're seeing here with COVID-19 infection is that this disease is anywhere about between, you can say, 10 to 20 times more fatal than a seasonal flu, which is why this is of such great concern to the public. And so please keep that in mind, that this is actually a very serious illness that all of us, we need to take the proper precautions against. Now, this is a graph that you've probably seen called flattening the curve. Here we refer to it as goals of community mitigation. We want to delay the outbreak of disease. We want to reduce the number of cases that occur each day. And we want to reduce the total number of cases in the community. If we look over here on this graph in the red, if we don't take the proper measures to protect ourselves against this disease, we will see a rapid increase in the number of cases, a drastic increase all of a sudden that reaches a peak very quickly. This horizontal line here indicates the level of healthcare system capacity. Simply put, we have a limited number of hospital beds. We have a limited number of ventilators and other healthcare resources. So if we don't take the proper measures, we will quickly see a number of cases such that it will quickly overwhelm our current healthcare system capacity. However, if we take the proper measures, which I'm going to discuss with you a little bit later, if we take the proper measures indicated here in the blue, we will also see an increased number of cases, but it will occur over a greater or longer period of time. And the number of cases won't be as great as if you see here in the red without taking protective measures. So in other words, if we take the proper measures, we will see an increased number of cases over a longer period of time, but it will be well within our healthcare system capacity so that people who need to be treated with COVID-19 in the hospitals, they can be treated. But if we don't take the proper measures, we will quickly be overwhelmed. Okay, what should I do if I think I have COVID-19? You want to call your healthcare provider for an assessment. Testing is done through your healthcare provider. Please, folks, do not fall for scams. Do not fall for people calling you on the phone or emailing you saying you can get testing at such and such a place. Right now, testing is done through your healthcare provider. They are the ones that are going to determine whether or not you need to be further evaluated whether or not you need to be tested, so please call your healthcare provider. Please note that local health agencies, including the Fairfax County Health Department, are not, repeat, not conducting testing for COVID-19. If at any time you have difficulty breathing, you need to call 911. Call the emergency room. Tell them that you have symptoms with COVID-19 before you go so that they can take the proper precautions, protective equipment, and so forth. You can also go to our website here. It's called Testing FAQ on the Fairfax Emergency site. If you go there, you can see more information on testing. A quick note on testing. Just because you call your healthcare provider, it doesn't mean that you're going to get a test. Okay? Your healthcare provider will use their clinical judgment. So if they think that your situation doesn't warrant a test, they're not going to test you. Also, maybe their clinical judgment suggests that you should get tested, but they don't have the proper equipment. Maybe they don't have the testing equipment, or they don't have the proper protective equipment. They may not be able to then give you the test, in which case ask them for an affiliated healthcare facility. Ask them if there's someplace else they can go, some other practice or facility that healthcare provider is associated with. If you are sick with symptoms of COVID-19, you should stay at home. For how long? Stay at home. At least 7 days have passed since your symptoms first appeared, and you have had no fever for at least 72 hours. That's 3 full days with no fever and no use of medicine to reduce that fever, and other symptoms have gone away or improved. If these 3 conditions are met after you got COVID-19, then you can resume contact with other people, okay? But definitely if you're sick with symptoms of COVID-19, you want to stay at home until these conditions have been met. What if I do not have access to healthcare? What do I do then? Here is a website. You can go to fairfaxcounty.gov. I know it's a long website here, but I'm going to leave the slide up here for a moment for those of you who want to write it down. You can go to this website. It has a list of low-cost healthcare resources for individuals who lack health insurance. And another thing you can do is called Coordinated Services Planning at 703-222-0880. Again, I want you to keep in mind for those individuals who maybe don't have health care and they're anxious and they're worried what to do because they may be experiencing symptoms of COVID-19. I want you to follow the advice that I put on the previous slide. Following those things, if you don't have access to a healthcare provider, that's good general advice for people who think they are sick with COVID-19. But I also want to emphasize that whether you have a healthcare provider or you don't have a healthcare provider, there is no magic bullet for this. I want to emphasize here, there is no cure that is sanctioned and approved for COVID-19, and there is no vaccine as of yet to prevent this disease. So whether or not you have a healthcare provider, the guidance is going to be the same. You have to stay at home until you fight off the infection. Get plenty of rest. Drink plenty of fluids, like water, especially water. So even if you don't have a healthcare provider, please know that it's not as though the people who do have access to healthcare are getting some sort of cure or medication that you're not, because there is no cure. And that also reminds me, please do not fall for scams. People telling you, oh, there's such and such cure for COVID-19. There is no sanctioned or approved medication to fight off this infection. Of course, as you may have heard, there are some trials underway to test medication, and there are vaccines. There is vaccine development currently underway, but these things are going to take time. It's not going to happen within the next few months that there's going to be some sort of vaccine. Definitely not for about 1.5 years. Medications, we'll see. They're conducting trials right now, but as of this hour, there is no approved medication to fight off, or cure, I should say, COVID-19 infection. How can we protect ourselves against COVID-19 infection? So there are things that we can do on an individual level. There are things that we can do as a community, and there are things that we can do in the environment. So let's go over some of these on this slide. So first of all, under personal things that we can do, you've heard this already, I know, frequent and proper hand washing. I know you've heard it a lot, but it's so, so very important that we need to keep hammering this point home. Cover our coughs and sneezes properly. We need to avoid touching our eyes, nose, and mouth. Very difficult thing to do. It's such a habit for us to do that. It's just so natural, but we need to keep in mind that this is how infection gets into our body. So the more we can avoid doing that, the better. Social distancing, another term I'm sure you've heard so much by now. Voluntary home isolation and quarantine. What is the difference between isolation and quarantine? Isolation is when someone who is sick with symptoms of COVID-19, they are sick with COVID-19. They know they have COVID-19. They are then separated from everyone else. That is called isolation. Quarantine is a contact of someone who is known to be infected with COVID-19. So you are a person who is healthy, but you had contact with someone who had COVID-19. They separate you from everyone else. That is quarantine. And they observe the person in quarantine to see if they're going to develop symptoms over a period of 14 days. And if they do develop symptoms of COVID-19, then they are isolated. If they don't develop symptoms of COVID-19 after 14 days, then they are let go. So that is the difference between isolation and quarantine. Basically, isolation is for people who are sick with COVID-19, and quarantine is for people who have contacts with people with COVID-19, but they are not yet sick. Another thing we can do on an individual level to protect ourselves against this disease is proper sleep, proper nutrition, and physical activity. So we want to make sure that we get 7 to 8 hours of sleep. We want to get a proper, nutritious, balanced diet, which gives us all of the essential vitamins and minerals our bodies need. And we need to get about 2.5 hours of physical activity per week. What the heck does all of this have to do with COVID-19? Well, doing all of these three things will help your immune system. And because this is a new disease, we don't have any natural immunity toward this infection. We don't have the ability to naturally fight it off. But the better off your immune system is, hopefully, inshallah, the better off you will be able to fight off this infection. So if you get proper sleep, 7 to 8 hours per night, you get the proper nutrition your body needs, and you get 2.5 hours of physical activity per week, all of these things help to ensure that your immune system is functioning at a maximal level. What are things we can do as a community to protect ourselves against COVID-19? Social distancing, again, we can dismiss or close schools. Of course, we've already seen that. Schools are closed in Fairfax County indefinitely. We are modifying work practices, and we can cancel mass gatherings, and we've seen that as well. And finally here, under environmental concerns, this simply means routine surface cleaning. So let's go into a little bit more in depth about each of these. So hand washing. Proper hand washing with soap and water really is the best way to keep your hands clean. If I can exit from here really quickly and show you with my hands, if I can show you with my hands. So you want to use soap and water, and you want to scrub both sides of your hands, as you see me doing here, both sides of your hands, in between your fingers, underneath your fingernails, scrub. Make sure you get your thumbs, and you want to do this hard scrubbing action against the surface of your hands for 20 seconds. 20 seconds. Let me get back to the screen sharing. Back to the slide here. Okay. So what we want to do is we want to practice frequent and proper hand washing. Remember, use soap and water for 20 seconds. If you're wondering about the temperature of the water really is not that important. What is more important is spending the 20 seconds. So you want to keep the temperature of the water at a temperature such that it's comfortable for your hands to spend the 20 seconds washing your hands. It's the friction of the soap against your hands, which is what kills germs and bacteria and breaks apart viral particles. So if you're not doing that hard scrubbing action of the soap against your hand for 20 seconds, you're not really getting rid of the virus, and you're not really killing germs on your hand. I suggest a good way of doing this is do it with your wudu. And hopefully you're doing wudu 5 times a day. It's an excellent time to practice proper hand washing before you start your wudu. Wash your hands with soap for 20 seconds, you know? And again, for those individuals who are so concerned about the temperature of the water, they say, no, 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 the water has to be hot. The water has to be hot. Just a reminder, the temperature of the water is effective at a temperature in which the water is boiling. But of course, you can't wash your hands in boiling water. You won't be able to even wash it for 1 second, let alone 20 seconds. So again, the emphasis here is on time. Otherwise, the temperature of the water is not going to be a big factor. And okay, oh yeah, hand sanitizer. So you can use hand sanitizers. We recommend the use of alcohol-based hand sanitizer because it's the alcohol which kills germs and breaks apart viral particles. But again, that's only a backup. The best way to keep your hands clean is with proper hand washing that we just discussed. What else can we do to protect ourselves? Cover our coughs and sneezes properly. By that we mean use your sleeve to cover your cough and sneeze, or you can use a tissue to cover your cough and sneeze. But if you use a tissue, throw away the tissue and then wash your hands like we just talked about. But one thing you don't want to do, you absolutely don't want to do, is cover your cough and sneeze with your bare hand. Because when you do that, everything that's in your nose and mouth comes onto your hand, all those germs, viruses, etc. And then you can touch your face again, or you can shake hands with someone or touch a surface, and this is how diseases spread. Not just COVID-19, but flu and all sorts of other diseases. And like we said, you want to avoid touching your face as much as possible because this is how infection gets into our body. We talked about environmental surface cleaning. So the everyday cleaning agents that you use around your home will be good to get rid of COVID-19 on surfaces. People ask me, how long does this virus last on hard surfaces? So on hard surfaces, these viruses remain anywhere from a few hours up to a day. Yes, it's possible that they could last even longer than a day, like 2 or 3 days, if the conditions are just right, like the temperature is just right, the moisture level is just right, and so forth. But for the most part, it's a few hours up to a day. And you want to make sure that you routinely clean surfaces which are touched very often, like a light switch or a doorknob or a table desk surface. You want to make sure that you routinely clean those surfaces with, again, your regular, everyday household cleaning agents. You can also go to the CDC for more information on cleaning agents, but it's just the regular household agents, really, that will be effective in removing these viruses. So don't spend too much time focusing on, oh, the viruses are going to be this many hours or this many days, but just their everyday routine cleaning will solve this issue. Sometimes people ask me, if I cough and sneeze into my sleeve, into my clothes, won't the viruses be there on my clothes? Again, the answer is on soft surfaces, these viruses don't remain on soft surfaces for very long. So this is not thought to be a way that the disease spreads. By the way, this doesn't really have to do with this slide, but I think I forgot to mention it earlier. Question: can you spread COVID-19 before you exhibit any symptoms? So you're healthy, you're not showing any symptoms of COVID-19. Can you still spread COVID-19 if you have it and you're not showing any symptoms? The answer is yes. Does it occur? Yes. Is it possible? Yes. All of those. It does occur. We don't know exactly with what frequency it occurs, but I can tell you it does occur. So, and that's one of the reasons why this is very contagious again and spreading so quickly to so many people, is because a lot of people feel healthy and fine and they're spreading the disease to other people before they show any symptoms. Okay, what else can we do to protect ourselves? You've heard of the term social distancing. We ask people to keep a distance of 6 feet between you and everyone else. Why? Because these respiratory droplets that we talked about, they don't spread very far. They don't spread farther than 6 feet. This disease is spread through close personal contact. So if you can keep a distance between you and someone else, even if you don't think that person is sick, that person may have the infection and they could be spreading it to other people before they show symptoms. So again, this is why it's so crucial to practice social distancing. You know, some people are in these grocery stores, halal stores, Middle Eastern grocery stores, and they are, sharing, they're in close personal contact, they are in close proximity in the stores, talking and stuff. You guys Please avoid all of this. This needs to stop. It's just because you're not in the masjid doesn't mean that you can't spread COVID-19 in the stores and elsewhere. You always need to be mindful right now until this thing is over to practice social distancing. So please keep that in mind. If you can work from home, and this would be a great workplace, this person has a forest view. But again, we recognize not everyone has a job where they can work from home. But if you can work from home, then work from home. That is an excellent way to social distance yourself from other people. Uh, People right now, they need to shop. They need to get their essential materials like groceries and food. We definitely don't recommend you to go outside of the house unless you absolutely need to. You can even get groceries delivered to your house. There's lots of ways to do that. But if you feel like you need to go to a store, there's something you absolutely need, like a grocery store or something, consider perhaps going at a time which is not so busy. That's what we see here in this image of an empty parking lot. So maybe consider going earlier in the day or at night when it's not so busy, so that way you're avoiding crowds of people. And again, with workplace practices, you may still want to have meetings. Okay, have your meetings, but maybe teleconference meetings. Do things like we're talking to you right now over Skype, we're talking to you online. So conduct your meetings, but try not to do it in person, but do it online. Or through your phone. That's another good thing to keep in mind as well when we're talking about social distancing. Okay, canceling mass gatherings and temporary closures. So you probably heard, that the CDC came out with guidance that they said they said to avoid gatherings of more than 50 people. The state of Virginia then banned, under the orders of the governor, he banned gatherings of more than 100 people. So that's law in Virginia. Then came the federal guidelines from the White House of gatherings to stop gatherings of more than 10 people. So now, of course, in Virginia is adhering to that. So gatherings of more than 10 people are prohibited in the state of Virginia, and Fairfax County is also observing that as well. So please keep that in mind, that no gatherings of more than 10 people. The governor of this state has given authority to the police to break up crowds of more than 10 people. It doesn't necessarily mean they're going to do that in every single place, but they do have the authority, maybe in restaurants or a theater or something, or some other crowds. They have the authority to disperse crowds if need be. And how long are these measures going to be in place? This ban on gatherings of more than 10 people, we don't know. No scientific or medical expert can tell you for sure exactly how long it's going to last. I mean, this is going to be our life, I can tell you, at least for the next several weeks, maybe longer. Inshallah not, but I can't tell you for sure what's going to happen, how long, many months or this and that. But definitely count on it being at least several more weeks. Okay, what's the deal with face masks? A lot of people have questions about face masks, and I know all of you are probably hearing information for and against and this and that. And so let me give you the health department, the Fairfax County Health Department stance on this. So here you see an image of a medical or surgical mask. This is what we call it. Who should wear this mask, if at all? So the answer here is that this type of mask, surgical mask, according to the Centers for Disease Control, according to the Fairfax County Health Department, this type of surgical mask should only be worn for people who are displaying symptoms of infection. So if you're coughing, something like you have a fever, you're coughing, then you should wear this mask to prevent that infection, from spreading to other people. But if you're a healthy individual, just out every day, hopefully you're not leaving your house too much, but the CDC and the Fairfax County Health Department do not advise that the general public wear this mask right now if you're just healthy and you think that this mask is going to prevent you from getting sick. The reason for this is twofold. First of all, this mask is not really all that effective. I can't give you a percentage about how effective it is, because you're going to see some studies that say one thing, and you're going to see some studies that say a different thing, that it's effective. Other studies are going to say, no, it's not effective at all. So what I'm telling you, after seeing all of this information, what I can comfortably tell you is that according to the information we have right now, Is it going to provide you as a healthy person wearing this surgical mask from getting sick? The answer is somewhat. It will give you somewhat protection. I can't tell you what percentage. It depends on what study you look at. But I can tell you that it's not going to be that effective. Why? If anyone has worn a surgical mask, you know it's kind of loose fitting. Respiratory particles can still get through the sides. Okay? So it's not that effective. You can still wear this surgical mask and still get infected with COVID-19. Okay? Um, so only wear this surgical mask if you are displaying symptoms. Okay, another type of mask that you might have heard by now is an N95 respirator. This is what this image is showing you. This type of mask is worn by people like in the healthcare field, doctors and nurses who are treating patients in a hospital who have COVID-19. This type of respirator provides a tight seal fit around the nose and the mouth. Okay, like almost no particles in the air are going to get inside their nose and their mouth. So this type of respirator is very effective at preventing COVID-19 infection. Is this respirator mask advised for people who are healthy, everyday individuals to wear to prevent them from getting COVID-19? Again, the answer is no. Okay, just like, and this is a similar reason to the surgical mask. I told you that the surgical mask is not that effective. But another reason we don't wear the surgical mask for healthy people is because we want to reserve these types of masks for healthcare providers. Same situation for the N95 respirator. We want to reserve these respirator masks for individuals who are in close contact with people who have COVID-19, like doctors, like nurses. They already are in severe shortage of such materials, okay? You've probably seen the doctors and nurses begging for these materials in some places. So we don't want healthy individuals grabbing up and hoarding all of these respirator masks. And it's really not required of healthy individuals to wear it. Yes, it's effective in preventing COVID-19 infection, but the doctors and nurses need it most. Practicing the hand washing, the social distancing, these things are the most important things that people can do as healthy individuals out there every day in the general public. So right now, according to the Centers for Disease Control and the Fairfax County Health Department, we do not recommend healthy, everyday people out there in the general public to be wearing these masks. What is the United States doing to respond to this? What is our national response to COVID-19? A U.S. public health emergency has been declared. There also has an emergency also has been declared in the state of Virginia. Guidance to health departments is being given, and their guidance is also being transmitted to the public. Coordination of surveillance with state and local health departments is occurring. A diagnostic test has been developed. Of course, we all know that there have been some, unfortunately, very bad issues with testing. They are working on increasing lab testing and getting it out to more people. Inshallah, let's hope and pray that this does happen and gets to places where the tests need to be administered. But that I can tell you that more people are getting tests than before, and I hope that this testing issue gets resolved and is just completely widespread. Vaccine development is currently underway. As I said, clinical trials of antiviral drugs to treat COVID-19 patients are also underway. And there is guidance for pandemic preparedness. So that's what we're doing at the national level. How about at the local level? What is Fairfax County doing to respond? We are at the health department identifying and investigating cases. We have, as I said, over 100 cases of COVID-19 infection confirmed in Fairfax County. You can always go to our health department website if you want to get the latest count on the number of cases. I can also tell you, unfortunately, we've had 2 deaths due to COVID-19 in Fairfax County as well. But we are identifying and investigating cases to prevent the spread of disease. We are monitoring people who are in isolation and quarantine. We are consulting with healthcare providers regarding persons who have illness consistent with COVID-19. We have given guidance on lab testing to physicians in Fairfax County. We are providing information to county partners and the community. That's what I'm doing with you right now. And we are planning measures to decrease the impact of illness if it spreads in Fairfax County. Again, go to our health department website. That's fairfaxcounty.gov/health/novel coronavirus. That's where you can get information on coronavirus at the health department. Fairfax County schools are closed, as you probably are aware. And if you go to this website, you can get information on where kids can get breakfast and lunches. They charge $2 for adults. For the kids, it's free. If you go to this website, you will see an extensive list of all the schools and sites where you can pick up food for kids. Travel advisories, and I'm winding down this presentation, I'm almost done. Travel advisories, if you have concerns about traveling, of course, you probably heard the State Department right now has advised all Americans against traveling outside the United States. But for further information on guidance about traveling, you can go to cdc.gov. The website is here. You can check information on travel advisories. Family and workplace preparedness. What is common sense is not necessarily common practice. So we want to promote and enable hand washing, covering our coughs and sneezes the right way, staying home and sick. We need to drill these messages into our lives. We need to make such practices an everyday practice so that we are prepared to prevent the spread of disease. We want to review sick policies. You know, people can't leave. Sometimes, I mean, people want to stay home when they're sick, but they go to work because they depend on that income. If you're a business owner, we kindly ask that you review sick leave policies. At least for this pandemic, allow your employees to stay home if they're sick. Enable social distancing, review and revise telework and flex time policies, reduce in-person meetings and travel, plan for high staff absenteeism and disruption of supply chains. And the thing I want to mention here is, folks, don't panic, okay? Inshallah, this is not the end of the world. This is a serious disease. I am not minimizing that. It is a serious disease. But inshallah, it's not the end of the world. We don't want to panic people, and we don't want to stress our bodies, which can also hurt our immune system. We want to act with prudence and preparedness, take the proper precautions, do everything that I've advised here in this slide presentation, and inshallah, we'll get through this eventually. For resources, again, you can go to our fairfaxcounty.gov/COVID-19 website. Some other resources, really quickly, the Centers for Disease Control. Here's another one, Virginia Department of Health. Good information there on COVID-19, Health Department website, and Coordinated Services Planning. Here is their website. They also have great information on resources that you can take advantage of. And finally, text FFX COVID to 888-777 to receive any and all updates with regard to COVID-19 in Fairfax County. Questions, you can email me at zubair.saeed@fairfaxcounty.gov, or you can email ffxcovid@fairfaxcounty.gov. Just a quick note about Islamic guidance. I had a slide, but I don't know what happened to it. But Islamic guidance for this, all the major Islamic organizations, whether you look at ICNA, ISNA, the American Muslim Jurist Association, the Fiqh Council of North America, American Muslims Health Professionals, the Islamic Medical Association of North America, all of them have put out similar statements saying that we need to follow the guidance of the CDC and our local public health agencies. And so that's what we're doing. I'm in close contact with the Virginia Council of Muslim Organizations, BCMO. I'm also in close contact with this Masjid, ICNA Masjid, and we are providing routine updates to the leadership about guidance and updates relating to COVID-19. With that, thank you very much.
Sure, Dr. Zubair, thank you so much for this excellent presentation. We appreciate you giving us all this great information. I hope our audience have benefited from this. Yes, we do have a few questions, and we go right to it. I have a question. It says, Assalamu alaikum, please discuss effective ways to social distances amongst one family. And also the same questioner, he says, how effective are supplements such as vitamin D and C to boost immunity?
Okay, let me tackle the second question first. So this kind of gets into my slide when I was talking about nutrition. So, of course, getting all the essential vitamins and minerals. Vitamin D is such a key vitamin for our bodies. Vitamin D deficiency is the most common deficiency in the Western world, okay, because obviously we get that from sunlight, but we can also get it through food sources like fortified milk and cereal. But anyways, vitamin D is essential for immune function. So getting enough vitamin D is very important to keep your immune system functioning. If you don't get enough vitamin D, you're more prone to getting flu and colds. And remember, colds are also caused by other coronaviruses. So, in general, it's good advice to get enough vitamin D, sure. And if you have concerns about getting enough vitamin D, talk to your healthcare provider. Vitamin C is also important for the immune system, as you probably are aware of. Vitamin C, it's interesting. Vitamin C is a water-soluble vitamin, meaning that if you get a lot of vitamin C all at once, some of it gets passed out in the urine. Okay? So in other words, sometimes people, when they get a cold, they think by fighting off the cold, they can take a lot of vitamin C, and it fights off the cold. And there has been a study showing that some doctor treated their COVID-19 patients with high-dose vitamin C, and he claimed that it worked. I want to be clear with the public that when you hear things about studies, everything in medicine is based on clinical trials and extensive studies, not anecdotal evidence, not a story of, oh, it worked here and it worked there, and therefore it's okay. That's not how medicine works, okay? So just because one doctor claims it worked, it doesn't mean that it's fact-based and it's science, and therefore we treat everybody with vitamin C. What I can tell you is it's a water-soluble vitamin, and if you get excess vitamin C, it simply passes out into the urine. So again, there's no known treatment, approved treatment that will cure COVID-19. What I can tell you is getting regular vitamin C and vitamin D is good for your body, and vitamin D has been proven to be so essential for the function of your immune system. The first question was social distancing in the home. So yeah, I mean, I have family members as well. It's a good idea. How to do it effectively? I mean, keeping a distance of 6 feet as much as possible. That's all I can say. Just try to do that as much as you can in the home. Try not to crowd around people. If you're around people, don't, at least, even if you're in the same house, at least don't be in such close contact for very long. Maybe you need to talk to that person really quickly, but try to keep a distance of 6 feet as much as possible from everyone. That's just the best advice I can give.
Barakallah Fik. I have another question. If a family member is infected, what are some best practices for the family to follow? Let's say family of 5 people, one of them got infected. What is the next step?
Okay, so if you think you have symptoms of COVID-19, you have a fever, temperature of over 100 degrees Fahrenheit, and you have a cough, okay, then you want to, what did I say? The first thing you need to do is call your healthcare provider. And then follow the guidance of your healthcare provider. If you need to be tested, they will let you know. If you're tested and you are positive, guess what? The Fairfax County Health Department will be in touch with you, and they will investigate your contacts, and they will give you guidance. They will tell you exactly what to do if you're in that situation. So you won't be left hanging. But in general, what I can tell you is that if one person in your family has COVID-19, it's confirmed, or they're showing, or let's say they're having symptoms of COVID-19, but it hasn't been confirmed yet, they should still isolate themselves from everyone else, okay? Even more than 6 feet, I mean, again, it spreads within 6 feet, but again, have them completely separated, maybe in a room away from everyone else, until the results come back to show whether or not they have COVID-19. If the results come back positive, they should be isolated from and separated from everyone else until 3 conditions are met that I put on the slide there. And you want to stay at home for 7 days. You want to wait until 3 days your fever has passed and other symptoms have gone away. So if all of these 3 conditions are met, then somebody can resume contact, with their family. Again, always keeping the social distancing message of 6 feet. But what I can tell you again is if you have this infection, your healthcare provider will be in contact with you, and the Fairfax County Health Department will be in contact with you, and they will give you detailed guidance on exactly what to do.
Great. Another question is, it says, will warm weather stop the virus from spreading? That's what we hope, right?
Okay, so with other upper respiratory infections, and this is a different disease because this happens to be a disease which infects the upper respiratory system, like your nose and your mouth, and it also infects the lower respiratory system, and it has a way to go deep down into your lungs as well. But with other upper respiratory infections, like the flu, for instance, the common cold, we see that these diseases, they kind of disappear, or they're at a low level in the warmer months, like in the summer. So this is a question that naturally has come up. Are we going to see the same thing with COVID-19? The answer is no one can tell you for sure. No one knows for sure. This is a brand new disease. We hope that it does, but we have seen disease spread in Australia, and that they were in their summer. So I'm not entirely all that hopeful that it will uh, disappear to a great extent. It may go down somewhat. I think what will make more of a dent is if people really social distance and are not in touch with each other, and things get shut down. I think that will have much more of an impact. The warm weather remains to be seen, but so far I can tell you, like places in Australia, it's not really becoming evident of that.
I see. Thank you. There's another question. They're concerned about getting mails and parcels. I know you touched upon this, but if you can remind us again.
Yeah, so we're not really concerned about people getting COVID-19 through this route, even if it's coming from China or Europe. People shouldn't be concerned about this. Again, the main route of transmission is respiratory droplets in the air coming into contact with them or breathing them in. Packages in the mail, this is not a cause for concern for transmission.
I see. They were asking about if there's any COVID cases in our community. I assume, I know you mentioned Fairfax. They're probably referring to Mount Vernon. We're located in Mount Vernon. Is that a concern? Do we have any cases now?
I can't, to be honest with you, I saw the count and I don't know. I know we had cases in the city of Fairfax and Falls Church. I can't, to be honest with you, I can't remember now if it was in Mount Vernon or not, but it may or may not be. If you go to our Fairfax County Health Department website, they may list it there. But what I can tell you is, folks, there's already community transmission in Northern Virginia, and this virus doesn't respect boundaries, okay? It's not like it's going to stop in Mount Vernon or at the border of Fairfax County. This thing is spreading in our community already. So people should take precautions and understand.
Understood. I think it says on the website of the government, it says only Alexandria, Arlington, and the highest cases, I believe, in Arlington and Fairfax so far in our area here. I don't really see any more questions here. How long do you think? Now, this is my question. We live in Virginia. We've seen what happened to New York, and now they're going through this accelerating phase. I think we're probably still in the initiating phase. When do you think we're going to get into this surge? Any anticipation?
I can tell you that the hospitals in the area, like I know, but they're anticipating a major surge in cases in the next week or two. So they're preparing for that. We don't know for sure if that will happen. I expect that what we're seeing in New York will happen in other states, like what we're seeing in Washington State, in California, and New York. Now we're starting to see what's going on in Louisiana. I expect that this will happen in other places in the United States. To what extent, only Allah knows if it's going to happen here to that. But like I said, I want to emphasize, we do see community transmission in Northern Virginia. That means it will continue to spread, and we will see more cases. When there's more cases, we'll have more hospitalizations, and we'll have more deaths. So I can tell you that's probably going to happen. Allah knows best.
So that goes with the emphasis is if it's going to happen, let's do our part on slowing this process as much as we can and take things seriously, especially in our community. And I know sometimes we go with this cultural and sunnah thing about shaking hands and hugging each other and kissing each other. This has to stop. And many of us already stopped this. So hopefully that will continue and we do protect ourselves and protect others. Dr. Zubair, I thank you so much, and the community, thank you so much. And I promise you we're going to have to bring you back again. We're still going to have more questions. Hopefully we can survive this safely and be safe. And thank you again for all your efforts to help us out to understand the process. Thank you.
Jazakallah khair. Thank you very much.
Jazakallah khair.
Keep us safe.
Ameen. Barakallah fi. So, brothers and sisters, on your behalf, I thank Dr. Zubair for being with us tonight and for his beautiful and valuable lecture.